Today we are going to be talking about intoeing, and we will attempt to cover all the important aspects in less than 5 minutes. Okay, so let's begin. The causes of intoeing is that of femoral anteversion, tibial torsion, and mitosis adductus. That is evident in this illustration on the side. Femoral anteversion. So that basically means that there is a medially rotated patella. It's a prevalent cause of your intoeing between your 3 to 6 years of age. At birth, the normal angle should be that of 30 to 40 degrees, and at skeletal maturation, it should be around 15 degrees. There is sometimes PIF pain, and this is often hereditary. Okay. On tibial torsion, it is most evident around 1 to 2 years of age, and it usually resolves by 6 years of age without any further intervention. When we speak about tibial torsion, the angle we are referring to is the angle between the bimalleolar axis, which is the ankle, and the bicondylar axis, which is the knee. So normally that should be at 20 degrees. Under mitosis adductus, this basically means that the foot is kidney-shaped. There is a medial deviation of the forefoot, while there is a normal alignment of the hindfoot. The prevalence is 12% among all newborns, and it is important to assess your active correction by tickling the foot. Okay, management of your intoeing. So for your femoral anteversion as well as your tibial torsion, generally, we just monitor for progression, and only when indicated we will do a derotational osteotomy. For mitosis adductus, generally we also monitor the progression because 95% of the times they correct by the age of 5 without any medical intervention. When it is mild to moderate, so there are different management options there. For mild, we can give them stretchers to correct the kidney-shaped foot, and in moderate we can do a serial casting, and only when indicated we can do an open edge medial osteotomy and closed wedge lateral osteotomy. So that is it for intoeing.